In this talk, we will start by giving an introduction to the global epidemiology of HIV. We will then explain what we mean by the terms prevalence and incidence, and will explain the links between these two measurements. We will then describe in more detail the epidemiology of HIV in the European region, before finally describing recent trends in morbidity and mortality among those with HIV. This lecture is comprised of 3 parts. This figure from UNAIDS shows us the most recent estimate of the number of people living with HIV globally. However, as this number is an estimate, there is some associated uncertainty. Therefore, UNAIDS also provide plausibility bounds to give an idea of the size of the uncertainty. These are given in parentheses after the estimate. This map of the world shows the geographical spread of infections. It is clear that HIV infections are not spread equally across the world. The vast majority of people living with HIV are thought to be in sub-Saharan Africa. Let us now consider the number of new infections that occurred in the most recent year. This is shown on the figure. Again, the plausibility bounds for these estimates are shown in parentheses. We can see that the large majority of these new infections are among people living in sub-Saharan Africa. In addition, the UNAIDS estimates the number of new infections in women and in men aged 15 years and older. It also provides estimates of the number of new infections in children, in young people aged 15 to 24 years, and in older people aged 50 or more. This figure describes the estimated number of people to have died from HIV-related causes in the last year. We can see that most deaths were in sub-Saharan Africa. This figure shows how the number of new infections per year and the number of deaths among people living with HIV has changed over time. We can see that new infections and deaths are decreasing globally. However, the situation isn't the same for all regions of the world. The figures for Eastern Europe and Central Asia are seen on the right-hand side of this figure. The scales on the y-axis are very different for these two figures, as the HIV disease burden largely falls in sub-Saharan Africa. Nonetheless, we can see that the number of new infections is continuing to increase in the Eastern Europe and Central Asia region. In fact, this region, alongside the Middle East and North Africa region, are the only 2 regions worldwide where new infections and deaths are increasing. When we want to describe how widespread an infection is in a population, we can measure the prevalence. This is the number of people in the population who have the infection at a given point in time or over a given time period. However, the total number of people in a population with the infection will be affected by the size of that population. Therefore, the prevalence is generally expressed relative to the population size, for example per 100 people or per 100,000 people. Once expressed in this way, we can then compare prevalences across settings where the total population size differs. To consider this example further, consider this table. It describes the total number living with HIV in 2017 in each geographic region of the world, and the corresponding prevalence for that region. So, for example, if we look at the row describing the Caribbean, we can see that there were 300,000 people estimated to be living with HIV at the end of 2017 in this region. This number is reasonably similar to the 210,000 people in the Middle East and North Africa. Yet, when we consider the prevalence of HIV, we can see that it is estimated to be 1.2% in the Caribbean. In other words, at the end of 2017, it was estimated that 1.2% of all adults aged 15 to 49 in the Caribbean are living with HIV. In contrast, the prevalence of HIV among adults in the Middle East and North Africa is less than 0.1%. So despite similar total numbers of people living with HIV in the 2 regions, the prevalence is more than 12 times higher in the Caribbean than in the Middle East and North Africa. This reflects the fact that the population of the Caribbean is much smaller than that of the Middle East and North Africa. We have seen that the prevalence gives us an indication of the total burden of the infection in the population. It tells us how many people are currently living with HIV. However, it doesn't tell us anything about recent changes in an epidemic. In other words, we would also like some information on how many new HIV infections have occurred over a time period of interest. This estimate is known as the incidence. The incidence tells us more about how the infection is spreading. Similarly to the prevalence, it is generally expressed relative to a given population size, for example per 100 or per 100,000 people. In this way, it can also be compared across populations with different total population sizes. The relationship between the prevalence and incidence of an infection is not always easy to describe. Let's consider this further with an analogy often used in epidemiology. Consider the bathtub shown here in this diagram. The level of the water inside the bathtub represents the prevalence or number of people with a condition in a population. The higher the water level, the greater the prevalence of the condition in our population. So we can see that there is a high prevalence in our example on the left-hand side. As the level of the water on the right-hand side is much lower, there is a much lower prevalence here. So what affects the prevalence of our condition? In other words, what affects the water level? The first factor that influences the level is how quickly more water enters the bathtub. If the amount of water pouring through the tap is slow, then the water level will only increase slowly, as we can see on the left-hand side. If, on the other hand, the flow of water pouring from the tap into the bath is high, then the water level will increase quickly. Here, the flow of water into the bathtub is analogous to the incidence of the condition. The higher the incidence, the faster the prevalence of a condition increases. However, another factor also influences the water level. This is the speed at which the water is drained from our bathtub. If the water leaves the bath at a slow rate, such as on the left-hand side of this diagram, then any decrease in the water level will be small. On the other hand, if the rate of water drainage is fast, such as on the right-hand side of this diagram, then the water level is likely to dramatically decrease. Here, the water drainage is analogous to the rate at which people die, or are cured, of the condition. Higher death rates, or cure rates, will result in a faster decrease in prevalence. In contrast, if death rates are low, then the prevalence of a condition is likely to decrease at a slower rate. Thus, the prevalence of a condition is dependent on the incidence as well as the rate of recovery and death. In the case of HIV, effective treatment results in a decreased death rate, which alongside the occurrence of new HIV infection can result in increased rather than decreased prevalence, at least over the initial period. Thank you for joining me for part 1 of this lecture. We will begin part 2 by discussing the prevalence of HIV.